Veterinary medicine is more than appointments, charts, and long days. It's passion, it's pressure, it's purpose. Sit, Stay, Listen is a podcast dedicated to the conversations that matter most in veterinary medicine. Clinical insights, innovation, mental health, leadership, and the realities of life in this profession. Each episode features real voices from veterinarians, technicians, assistants, and receptionists sharing honest stories, lessons learned, and perspectives from the front lines. If you care for animals and care about the future of veterinary medicine, this space is for you. So take a moment, sit, stay, listen. Hi, welcome to Sit, Stay, Listen. I'm Dr. Austin. I've been a doctor for about 13 years, and I work in general practice.
I'm Benjamin Lord. I've been practicing for 5 years now, and I'm also in general practice.
You know, it's funny that you say you've been practicing for 5 years. I feel like you've been practicing forever. I just feel like you graduated a whole lot smarter than me, so that's awesome.
I don't think smarter. I think I'm just more of a nerd and remember nerd things.
That's true. Yeah, that's true. I try to be nerdy, but I fall short. I think I just have too many distractions. So this is our first podcast. We're going to talk about veterinary medicine as a whole and what it looks like today versus what it looked like when we were young, and how it compares a little bit to human medicine. So to me, when I was growing up, veterinary medicine was you took your dog or cat, mostly dogs, to the vet, and you spayed them, neutered them, and you got them a rabies and called it good. Unless you had a flea problem, then you took care of that. How did it look like? Because you're a bit younger than me. I'm 44.
Yeah, well, I was raised by kind of like wannabe farmers, honestly. And so for me growing up, animals were animals, right? You didn't take them to the doctor. You just kind of got them already fixed. And then when they got sick, they just kind of left mysteriously. Yeah, yeah. But there was a couple times I remember my parents taking, the dogs to go to the vet. But whenever they went to the vet, they did not come back.
Yeah. They went and lived on someone else's farm. Wink, wink.
Yes, they did. Nudge, nudge.
That's so sad. Well, I feel like nowadays veterinary medicine has become a lot closer to human medicine, to where the expectation of medicine for these pets is way higher. Frequently we're taking x-rays, doing blood work, when people bring them to the vet, but it's expected nowadays to spay and neuter, as opposed to just kind of being like a yard dog, a farm dog who you never do that for. So medicine to me has significantly improved for pets, because now we see them as family members, which is great.
Yeah. The shift from it's just a thing I have to this is a member of my family. I think I noticed that right before I went to vet school, because a lot of the people I grew up with were like, yeah, it's my dog. I love my dog, but it's a dog. And now I see people I went to school with, they're like, this is my child, because, well, it is. And that transition was interesting to see in real time going through school, because you saw these people coming through and it was very much, yeah, animals, medicine, cool. And then it became, okay, welcome to fourth year. You're going to learn how to be a therapist to humans, even though you're an animal doctor.
Yes, frequently I have clients who, I remember when I first bought this clinic, that I had a client come to me, and the first thing out of his mouth was, this pet is, all I have left of this family member I lost, 15 years ago. And that's really hard. That's like something that kind of takes your breath away for a minute. It's like, oh, no pressure. And the cat was 19, and he was like, I need it to live forever, essentially. And obviously the cat just had a urinary tract infection, so it was fine. I didn't have to deal with that tough decision that day. But yes, I hear that fairly frequently. People lose children, or they lose a spouse, and this pet represents them and got them through that hard time, and it's hard for them to let go. So but yeah, so in addition to veterinary medicine changing, when I was a kid, again, you just had your local vet, and that's all you had, and they would do what they would do. And then that, if they couldn't do something, there was no other option. There wasn't, where else can I go? Sometimes veterinary colleges, if you owned horses or cows, the veterinary colleges would do more specialty surgeries, but not a significant difference from your local vet. And nowadays, we have the option to refer to neurology, cardiology. We obviously can send out images to a radiologist and have them review that. So oncology, that's a big one. So if your pet has cancer, back in the day, that was it. That was the end of that. But now there's radiation and chemotherapy for pets.
Oh yeah, and the stigma around it's different too. Again, when I was a kid, you'd hear about, the animals who got root canals with those titanium teeth put in. It was really cool if your friend had one, but it was like, why would you spend the money on that? And now I have conversations all the time where it's like, would you like a dentist? Would you like a root canal? Or
Yeah,
you just want to pull the tooth?
I forgot about the dentist. You're right. Yeah. The root
Yeah,
canals are nice for
yeah.
canines. We don't have to pull those beautiful teeth. They can just fix them. Yeah, that's good. I get asked a lot about doggy braces. I don't know
I
if
have
we've reached that
seen,
point.
yes, I have seen two, and they were in golden retrievers, terrible teeth, and they hadn't tightened just every other month, just like a human would. And their smiles were beautiful afterwards. And I
What?
remember looking at them going, don't they get it caught in their toys? Like the things that we want to do from human med to vet med don't always translate too. And it's always really interesting to see us try and then it's successful in its own weird way.
And I feel like it, with doggy braces, dogs, if they have pain in the mouth, they're not really pawing at their mouth. It's pretty rare that they do that. And that'll be a whole nother podcast episode on how to tell pain in an animal, but they're not really pawing at their mouth. So it's probably very successful that they don't remove them by pawing at them. So that's great. Something
Yeah,
new
it's
I learned today.
fantastic.
That's pretty
New
funny.
things every day.
Well, to me, what's different about, or what's difficult about veterinary medicine today, because these things happen fairly quickly, in my opinion, without the adjustment that we really need, is that, if I go to a human doctor, I go to my general practitioner, it's immediate that I'm sent to a GI doctor or, someone else but as a general practitioner, we're still expected to do quite a bit. To handle, we're expected to be on a daily basis a radiologist, a dermatologist, an internist. We're handling pretty major diseases that, in human medicine you would never see a general practitioner handling, unless I guess you lived out in the middle of nowhere. But
Oh yeah,
so
yeah. I've talked to a handful of human GPs and human nurses, and when I tell them, yeah, I look at my own rads and I do my own anesthesia while I'm doing surgery, and then I go out and do some skin stuff, and then I just go ahead and do a biopsy. They look at me like I grew two heads, and they're
yeah.
like, "Why don't you have those things?" And I go, "Yeah, but like they get the really cool stuff, the stuff that I can't figure out." And then I remember people going, okay, so XYZ, XYZ, and we got into this huge conversation about it. And then I flip back on them. I do less than GPs did 20 years ago. Like there is some stuff people who trained me did that I'm like, why would you do that? Dermatologists exist. And I haven't even like considered touching it.
Hmm. Well, it will be nice in the future as we progress, because one thing that I've noticed a lot more of in the last decade or so is insurance for pets. Now, I have mixed feelings on that because the insurance for pets still do the pre-existing conditions. And so you can't just go out and get insurance when they're 7 years old to help treat that cancer. The positive thing about pet insurance is that you pay one deductible one time for the lifetime of the pet. Typically, now insurance is going to change, week to week, the other or month to month, I guess. But the other thing I, like is that veterinarians are not involved in that insurance. We don't have to deal with approvals and codes and things like that like human medicine does. So that is to me a positive for right now. I'm sure that will change in the future as there becomes more and more insurance and it becomes more affordable. Um, uh, that's a difference as well. Some of those people that have the insurance are able to say yes a lot more often. So the
Oh
referrals are
yeah.
a little bit better. I know that you were asked recently by a medical professional to do like a biopsy of the neck or a mass removal in the
Hmm.
neck. That was like, no way,
Yeah.
you know,
Yeah. That
but
they were just
heavily
like,
pressured to try it.
oh yeah. And they were like, why wouldn't you? And I said, honestly, by being 100% honest, I don't have the materials I need to do that safely. Because if you do the same thing,
Right.
if you go to a hospital, they will take a CT, they'll do an MRI, they'll plan it out, they'll have an active ultrasound. They have multiple people focused on the problem so you can focus on the one thing you're doing. And if I'm doing it willy-nilly on my own, I'm just praying I don't hit something important. Whereas we do now have specialists who can do that situation. I know, I don't know about her in particular, but dental, because it's the main thing I do for outpatient, apparently. They had an anesthesiologist and a dentist and a backup doctor all doing this. And it was just a mass removal, a tooth removal on this one dog. I can only imagine what they would do for the more advanced stuff where you need to have an MRI and then get there quickly and get everything going. And that was unheard of even when I was just in school 5 years ago. It was something that
Yeah.
only the universities did, and now you have all the local ERs who are kind of becoming competitive with the universities.
Yeah. Well, not monetarily wise, cost wise, they're they're about twice as much, right? Universities are nice because it's a teaching hospital and usually it's a little bit cheaper, but um and then the like money drives everything, right? So it's nice that people are willing to spend more money because with more money comes more research, more interest. And so like to me medicine has gotten so significantly better for pets as far as medications. Like there's quite a few more, way more. Like when I was young, the only pet specific medications were flea meds, right? Like I don't
Yeah,
remember there
yeah.
being heart medications for a pet. The pain medications have come a long way. Rimadyl, I think, was probably one of the first that I remember pet specific medications. And I was like, huh, as opposed to just using a human med or just having to go without. So that's been really nice. That's a big change in veterinary medicine. The options for medications and treatment have gotten much better. One notable one is FIP, right? Like that's a
Hmm,
virus that
hmm.
now technically there is a cure or at least a treatment um, that's available. Kind of gonna have to go through the back door to get it, but eventually it will be, marketed and sold by larger distributors.
Yeah, I think it's FDA approval was done this last year, so it is available now. But I remember my first year in school, they said FIP is a death sentence. You see an FIP cat, you tell them you put it down. It's done.
Yeah.
Don't let it suffer. And then my first year out, FIP Warriors was like, hey, no, there's treatment. Let's do this. And then just in the last 4 years, I have 4 surviving FIP patients who just are living
Wow.
their happy little kitten lives.
Yes. Right. And part of that is it's parallel with human medicine. Of course, that always helps.
Mm-hmm.
Human medicine, there's so much more money in that, and so they start the research, and then we kind of like, oh, I could probably use that, with pets. So that's
Mm-hmm.
really cool. A lot more research with pets, um, allowing for just better medication for them and better treatment.
100%. Whenever people come in, they ask me about all the cool, vet things we do. They ask me questions like, knee replacements and hip replacements and heart patches, for the really intense cases. And they're like, do you guys do that? And I say, well, I'm not sure. I don't. Lord knows I don't. But it is something that I don't think we're there yet because we're about 20 to 30 years behind human medicine. It's kind of like we're
Oh
practicing in
yeah.
the 90s.
Well, and yeah, well, because they are still pets, and I know that's, hard for some people to hear, but there just isn't that many advances. I get asked a lot, does this blood work show cancer? And I'm like, not really. Cancer markers are a big deal in people, and they've discovered all of these, cancer markers because of research and money that's gone into that research. And, blood work can indicate certain things, but it's definitely not going to show cancer. I can probably count on one hand how many times just general blood work has shown me that it's cancer.
Yeah.
Um,
Yeah. And even just
so
that, I think in the next 3 years, we'll finally have a blood test that can tell us 3 very specific types of cancers via blood work. But there's still how many body parts are there with layers of cells that can cause cancer?
right,
Just
I
so many.
know medicine is so intricate, and but they IDEX does have the one for lymphoma. I don't know how specific it is, but I know you can
I
get
haven't
false
read into it.
negatives, but you don't get any false positives. I do
Well,
remember
that's
that.
bittersweet, I guess.
Right. I don't know. I would say the only frustrating thing I feel for current medicine is that we're not keeping up with the growth as far as the number of veterinarians and the expectations on veterinarians. One thing that actually is a positive to me is that when we were young, vets were on call all the time. You were the vet
Oh
24 hours a
yeah.
day. And
You were the
nowadays we do
community vet.
huge benefit of not being on call constantly. And that has saved a lot of lives, in my opinion. A lot of people stay in veterinary medicine because you don't have to be on call. You can be home with your family. It can be either 8 to 5 job or a 5 p.m. to 2 a.m. or whatever. You can choose your schedule. You can work overnight, but you don't have to, which has been nice.
It's fantastic. It is one of those things. I heard horror stories from people who got out of school just a little bit after I did, even just in fourth year. They were pushed. They were pushed the same way that residents were in human medicine. You're working their 23-hour shifts. You're just go, 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 go. You're always in the hospital. And then by the time I got there, they had changed everything. And it was about the time that human medicine had the same push for work-life balance, where they were like, you're only allowed in this building for 12 hours, and then you have to leave.
Yeah.
You cannot stay here. If your work's not done, that's too bad. It is good, but it was interesting to see medicine and medicine culture change in real time like that, because I was listening to some of the older residents. I complain. You complain sometimes. Life's life. And I say, wow, I'm so tired and I'm overloaded. And they come out with when I was in fourth year, I was working 3 days straight and I slept on the floor. And I said, good for you. I'm still tired.
Yeah, that sucks. Well, my final year was not. They took it easy on me. I went to Ohio State, and I don't remember them torturing me. I don't know that I would have survived that. I also had a job at the same time, so.
Oh, I couldn't imagine working at the same time. Oh.
Yeah. Well, my fourth year I didn't work as much, but anyway, but yeah, it would be nice to keep up with the demand, especially during COVID. And that could be a whole nother podcast episode, but during COVID, the demand just skyrocketed. And of course, we live in a country where instant gratification is expected nowadays. So
100%.
A lot of people left because of I don't know about bullying, but just the anger behind the demand. Right now I need to be seen right now. And it's like, and in the, before, because vets weren't seeing pets every 15 minutes, that was doable, but now just with the demand and not as many vets, the average class size is what, maybe 95? That's probably gone up since I graduated, but
I think there were 130 in my class, and then 115 graduated, something like that.
Oh, wow. I think only about, my class was right around 100. I can't remember, maybe 115, but I think we had 2 or 3 fell out, the rest graduated.
I think so. The way my school worked is if you didn't do well for one class, they didn't just say, okay, you're done, you dropped out, you failed graduate school. They said, okay, let's take a step back. You're going to be held back a year, but you're only going to take that one class for this semester, and then you're going to catch up with the class behind you. And that's how they did it. So I have quite a few colleagues and friends who had that happen to them, and they're fantastic doctors. They just got hiccuped because cytology was hard or histopathology was hard, and you just focused on anatomy instead, and then you just let things slip through the cracks. But then when you got up to it, you were fine. And now that they're out practicing, they're doing so much better than I remember school being. School was rough.
Well, it's a lot of pressure. You put a lot of pressure on yourself as a veterinary student, because the pressure just to get in, from high school, you're told your grades matter. Of course, you have to get all this experience, but you have to keep those grades up. So you just feel that. And then, of course, vet school is you go from high school to college, and college obviously is significantly harder. And then you go from, undergraduate to vet school, and you're like, I didn't think this could be harder. You're like,
I was always the smart kid.
Yeah, exactly. Then you're putting a room full of smart kids, and you're like, I'm an idiot.
Oh, I'm not the smartest in the room anymore. This is fun.
And it's such a competitive field, but I do wish they would make more, because, people always ask, why is it harder to get into vet school than med school? And to me, the entrance isn't harder. It's just the number of spots are so few. When I
Hmm.
went to school, there were 34 schools, I believe, that were options that were accredited,
Hmm.
including the island schools. That didn't include other international, like Sydney was an option, or Ireland,
Hmm.
Dublin was an option, London was an option. But if you were just looking inside the United States, I think there were 32 schools to choose from, and that's not even one per state. And again, that was 2008 when I went into school, and I think at that time the average class size was about 100. Um, so it was like, I mean, that's 3,300 kids a year. That's not a lot. But now they're starting to increase class sizes and hopefully building more schools. But med schools, I think there's, more than one per state, and the
Oh
class
yeah,
sizes are much.
definitely.
Hmm.
I think there's like
So,
38 accredited now, if I'm
oh,
remembering
schools?
correctly.
Med
I
schools?
think so.
Yeah, that's
Because while I was down in St. George's, we got our accreditation my end of my second year. So we didn't need to take the entrance test. I could go straight to the NAVLE, which was great because from what I heard, the entrance test was so much harder than the
good.
NAVLE, or so how people said. And that's another big thing I'm seeing too, switching from that is our doctors are more accreditations being put out there. So our doctors only need to take the NAVLE instead of the big test. So we are getting a couple more doctors that way. I've also noticed that the stigma of the island schools has kind of gone away. Because when I
Yeah.
was in high school, it was like, oh, you went to the island school. You weren't good enough to get into a state school. And now it's like, oh, you came from an island school. Cool. How were the beaches? And you're just treated as
Yeah.
an equal colleague because, you know your stuff. It doesn't matter where you went as long as you pass that NAVLE.
Yeah. If you're called doctor, you did something right. So, and you've talked about your school compared to mine. And to me, it was kind of like Cornell because Cornell does a lot of case-based, and I think you guys did a lot of that. Whereas at Ohio State, it was book study, study for the first 2.5 years, some rotations of clinical work, and then it was a clinical year. So case-based would have been really nice for me because I probably would have learned a little bit better that way. But that's okay. I had Dr. Barringham
there,
when I grad.
there's been a big push too to be more hands-on. So One Health, One Medicine was a big thing. And so I was thankful that St. George's was also a medical school. So I got to talk with all the human physicians
Oh,
and learn off them. For some reason, we were always one module ahead of them. So I was tutoring them sometimes about stuff.
oh,
And then I'm
interesting.
like,
Yeah.
yeah, but I'll be talking about something like, oh, that's for a dog. You don't need to know that. That's for a horse. You don't need to know that.
That's that's species specific. Yeah.
Yeah, but we all
That's
get
funny.
together. We go out in the community because part of the agreement, I think, I could be wrong, but part of the agreement to have that land granted to the school is they had to go help the nation of Grenada, and everything there was we'd go out every weekend and be hands-on. I was practicing my second year. I was doing
That's
TPRs and physicals on
crazy.
goats and horses. I got to work on a monkey, which was weird, but you just
Masking
kind of get,
gloves,
yeah, masking gloves and
avoid
everything.
tuberculosis. Yeah.
And they just threw you out there and they're like, okay, go be doctors now. We're like, but I'm a baby. And they said, we need bodies. Go, and
Yeah.
then talk to
You
your
got to work. Sink or swim,
teacher
baby.
and we'll get it going. And it really
Because
taught
I
us a
mean,
lot.
obviously there were vet schools before when we were young, but I think a lot of their learning was apprenticeship. And I think that they try to do our last year as apprenticeship, but when they're requiring you rotate every 2 years, it does make it difficult. So it would be nice if they, if we had to do apprenticeship for a year or two, because then employers would be required to provide you with mentorship, whereas sometimes they promise it and you just don't get it. And so then it really is, it's a lot of book learning and hoping and praying, and that's not a great way to be, right?
Yeah.
Um, so, so yeah.
I
Um,
think I think in our lifetime, we will see vet med break apart. And I think you will see doctor of veterinary medicine of canines and companion animals and the doctor
oh,
of veterinary medicine of horses, because there's so much information now and so many new cool things coming out. Like I can probably, if you drop me in the middle of Kentucky, I could probably help a horse out. It wouldn't be perfect medicine, but I know enough that I could do something.
I would
But
have to call a friend. What do?
yeah, I'm in no means a horse veterinarian. I am a dog and
I
cat
think the
veterinarian.
I, I think the only reason they don't do that now is because, you go into your interview and they ask you, what are you interested in? And they want to hear cows and horses because people don't want to do that anymore. Another big change between veterinary medicine back in the day and now is the number of women, right? So I'm sure when you went to school, your class was probably 95% women and 5% men. I think we had in a class of 100, you know what? I think we had 140 in our class. I should look that up. But I think in 140 people, we had maybe 10 guys.
Hmm.
In
Hmm.
50 years ago, would be all men, right? And so, of course, as females, we tend to be smaller, we get pregnant, those kind of things. And working with a cow is like, I don't want to be kicked. Like, I don't want this thing to shove me around. So, not that a man wants to be kicked, but
No,
you're not going
no. But it's also one of those things you can't just jump back into it. I wanted to do cows for the longest time, and then COVID hit, and my network kind of died. And then I was like, okay, cool, dogs and cats. I like dogs and cats. Let's go work here, and it was fine. And I remember you and I were talking a while ago that I would one day have a truck, and I would drive around, our local
Yeah.
farms and say, hey, I'll see your cow. And now I'm 33 with 2 kids, and I'm like, I don't want to hurt my back. I'll keep seeing the chihuahuas.
hmm Yeah, no, I mean that's another thing about vet medicine. I think that's why they haven't divided them, is because they want you to go through those rotations just in case you become interested. I think
Hmm.
that's the idea of
That's
undergraduate as well. That's why they have you go through all these classes so you're not an idiot savant. You're exposed to these things or hoping to change your mind or you need to at least know some of these things to, just in case USDA calls, they're gonna recruit us like the Vietnam War.
yeah, yeah. Congratulations, you get to go do this now.
Yeah.
But that
I
is,
would say one bad thing, a change in veterinary medicine is it was all mom and pop before, and you were all,
yeah,
you knew your clients, you knew those patients, and nowadays it's not. And some of that is supply and demand, right? Again, there's way less vets than are needed, and so people are having to wait, and so and vets feel very pressured to see a lot. Instead of seeing 6 to 10 patients a day. Now we're seeing 30 to 35, and so that puts a lot of pressure. It's hard to know your patients when you're seeing so many of them. And of course, you see these frequent clients who have several pets or they have a pet with issues, and you get to know them pretty well. But um, I would say that's also a change. And then obviously another thing that affects that is corporations buying clinics.
yep.
And so when they buy clinics, they see a bottom line as opposed to, and it's not that the vets don't care. They're just having to keep up with what their employer wants. You put these expectations and you have to keep up with that based on corporate expectations, which is it's not a good way to run a business that's about caring. Veterinarians get into vet medicine for the love of the pets. It sure as hell isn't money, and it's not quality of life, right? Like you're in it because you love animals and you love medicine, and so you put those things together and you have a veterinarian.
Oh,
And then
100%.
when you put a business person next to that,
Mm.
it's not a good mix. I mean, it just doesn't. And so we had quite a few people leave during COVID for that same reason. I think the stars aligned in a very terrible way, that the supply and demand, or the supply went down, the demand went up, but that demand went higher because you're dealing with a business person as well. We need to see the growth. Every year you want to see this amount of growth, and it's like, well, that's not what I got into this for. Like, you're making this more about money than you are about compassion and care for the pet, and that's what I got into this for. So that's a pretty negative change, I would say.
Oh yeah, the goods and the bads always kind of correlate with one another too, because this is my baby becomes, oh, it's your baby, is it? Okay, so we're just gonna start making all these things a bit more expensive because it's your baby, right? You care,
Mhm.
right? And then people feel pressured to do these things, and there's just so much information now. I remember talking with one of my interviewers, that's the right word, one of my interviewers, because I had known them for a little while. And they would just do stuff like old school vet. They would go, okay, you get steroids, you get these antibiotics, we're gonna do this test, we're gonna do this surgery. And when I got out of school and I had the opportunity to talk with them again, and they were doing these same things, I'd ask like, oh, why didn't you do an LDDS? Why didn't you do an ultrasound? And they said, oh, well, I know what this probably is. I'm comfortable moving forward with the decision, and I'm just going to do it. And now, if I did that and something bad happened, and God forbid I got sued, I know that's malpractice now because medicine's come so far. I have to
Absolutely.
offer
Yes.
those advanced things.
Yep. And that's sad too, because there are veterinary lawyers. There didn't used to be a whole bunch of veterinary, just was a lawyer and nobody was suing over their dog or their cat or their cow. But nowadays, God bless America, I get threatened, but it's mostly people that don't understand medicine or don't decline these things anyway. I'm going to sue you, and it's like, well, you're not, but I get threatened anyway because that's just kind of what we do in this country.
Oh yeah, I think the biggest issue I've had, other than learning medicine and dealing with negative effects of medicine, is that I went into this expecting that classic Hallmark movie, like, oh look, it's the vet at the city who knows every single pet here. He knows what lives and breathes in this city, and he knows them all by first name. And they sees them at the store, and they're like have a good rapport. And now we've reached a point where I've had people look at me and talk to me and look at me with that look of, you're a doctor after my wallet. You don't care about my patient. When I'm just
Oh, I
sitting there
know, like a mechanic.
trying to do my best. Yeah, exactly. And I'm like, I promise I'm not trying to upsell you things. I need this for information, for data. If you don't want me to get that data, we're going to do our best, but it might not do what I want for you. And then, you feel bad, and you don't want to see that patient again for a while because they're frustrated. And then that hopeful, just patient love that I was hoping for from Hallmark just kind of went poof pretty
Yeah.
quick. I
And
think
that's
I
hard,
can.
right? Especially when to me, we've been through quite a few dips in the economy, right? And pets are still put high on the list from my experience, people still put pets high on their list of things to spend money on. If your car breaks down, you're gonna spend money on it. If your dog gets sick, it's obviously not everybody, but it is hard. You really have to show the value in what you're presenting for people to understand. And sometimes I have to explain medicine, uh, hopefully on a level they can understand, but explain it and say, okay, I can guess, but this might go very poorly for these reasons. If I know that this is not happening, then I'm okay to put them on. Can we just do the bare minimum? Trying to just whittle it down to something I can work with. Um, but yeah, it's hard because again, you're right about the marking up, like to charge more. So like during COVID, a lot of these corporate ERs, I mean, it was like an exponential increase. I remember a splenectomy going from $3,000 to $10,000 in a matter of 6 months. And it was like, I see what you're doing there, and I think that's terrible because they have no other option because we were told to stop doing surgery. We were seeing way less patients. We were seeing them in the car. And then all of a sudden these ERs start charging $10,000 for a pyometra. And it's like, that is not a $10,000 surgery.
Supply
I get it.
demand.
I mean, God bless you for charging a little bit more because of the amount of time you put in to become that specialist. But now you're making them choose between their mortgage and their pet. Um, and that's another corporate thing, right? Like that's that we do it because we can. And a mom and pop would never do that, but that's veterinary medicine today.
Mm.
I did find out somewhat recently that most clinics are still mom and pop. I would say something, I think the
Mm.
statistic is about 35% are corporate. I think that's probably still changing. Um,
Oh yeah. And then I
but,
think a lot of those mom and pop shops might fall under the umbrella of like a conglomerate where it's a bunch of mom and pops working together, but they share a title. Um,
mm,
and I think it's just playing statistics a little bit. But let's see, in our area, 1, 2, 3, 4, 5. I can count 6, 7. I can count 7 vet clinics in our area within a 15-minute drive, and I know for a fact 4 of them are corporate.
oh, really?
Mhm.
Well, there's
Mhm.
oh yeah, I guess I should name them, but there's the one down the road
Yep, and
towards
then
the
it has a
highway.
sister. It has a sister clinic over in Kent, so that's right there.
Oh, I see.
Um,
Uh-huh. Oh,
and
yes,
then
that's
if you go
down
real
the
fast, you can hit Renton, and right there you have another one, and then Blue Pearl. Love Blue Pearl. They're just right into Tukwila.
yeah.
Um,
Actually, I'd take one of my pets to Blue Pearl. They were wonderful. expensive, but they were wonderful because they're criticalists. I mean, that goes back to GPs versus a specialist. Obviously, as a general practitioner, I can't fix everything. I had to take my pet to a specialist. So that should tell you right there that they are necessary, and just the pricing is a bit much. But I think they've calmed down a little bit. We got a fax like maybe about 6 months ago that said we've reduced our surgeries by 30%. Oh, good. So I think that's calmed down a little bit, probably from a little bit of backlash. But anyway, yeah. So, veterinary medicine today to me is a little bit more advanced, a little more specialized. We're going to see that change, I think, significantly over the next 10 years as well. You see it, branching out to being more specialized. I actually hope that insurance does take off and people get more insurance, because the expectation is to provide human level medicine for these pets, but you're also going to pay for that. And I feel like if insurance doesn't go in a terrible direction, if it goes in the right direction, being affordable, actually covering things, not denying claims, that kind of stuff, then I think veterinary medicine will actually progress into something pretty amazing. What we can do for.
I just honestly hope it stays like property insurance. I really hope it continues to be, something happened, we're going to pay it out. No questions asked. Well, questions asked, but no big questions asked. Yeah. Instead of the loopholes and everything you got to jump through with human medicine. I know my own insurance, I've had to deal with some stuff, and it was so much easier just to call an insurance company about one of my pets and just say, hey, this happened, XYZ, are you going to cover it? And they said, oh yeah, it's in your policy. That's just how we do things, instead of, you should submit this form so we can reevaluate, double check all these things, and just overwhelm you with paperwork.
Hoops to jump through. Yeah, I agree. Like we have one insurance company where we can send the invoice and they're like, yep, we'll pay this amount, and they go ahead and pay it. It's never, a long time. I mean, I have some clients that are frustrated about a denial of a claim, but that has to do with pre-existing conditions. So, but I hope to see it improve. Hopefully we all go in the right direction if we have the right leadership, the up highs, steering it in the right direction and not allowing it to go too far in the human medicine direction where insurance oh, that's no good. I think that's a failed system. So
I agree.
But anyway,
I agree.
Well, it's our first podcast. This was fun.
Yeah. It's always fun to talk about things.
All right, we'll see you later.
We'll catch you later.
Thank you for spending time with Sit, Stay, Listen podcast. If you found today's conversation meaningful, be sure to subscribe, leave a review, or share the episode with someone. Until next time, take care of yourself and keep caring for those who depend on you.